From the plant Cannabis sativa L, we can get many products, from fiber for clothing, to cellulose for methanol fuel conversion, from oil for cooking, to a high-protein food supplement, from a green natural fertilizer to a highly useful medicine. Cannabis can supply all the raw material necessary for production. In this film, we are going to look at the medicinal use of cannabis. It should be noted at this point that currently the term used to describe the drug portion of this plant is marijuana. The use of the term, however, is incorrect. It would be more scientifically correct to refer to the medicinal substances obtained from the plant as cannabis or cannabis preparations. The history of cannabis use in medicine is widely documented in both Eastern and Western medical literature. Its medical use is noted in Chinese documents dating back to 2500 BC. The first Western documentation of cannabis's medicinal properties is in 1547, when the plant is scientifically named Cannabis sativa. It wasn't until the 1830s that Dr. O'Shaughnessy makes note of cannabis's medicinal qualities in his paper titled On the Preparations of the Indian Hemp, or Ganja. In this work, he notes the botanical description of the cannabis plant with remarkable accuracy, taking special note of the calyx, covered with brown glands, on the female plant. He also notes the fibers of the stems are long and extremely tenacious, so as to afford the best tissue for cordage, and further that the seed is devoid of all narcotic properties. Dr. O'Shaughnessy, in his report, described the chemical properties of the plant. He also describes in great detail the medicinal properties and conditions to be treated with cannabis prepared in a variety of forms. From the mid-1800s through the late 1900s, many articles were written on the uses of cannabis as a medicinal substance. It is apparent from the vast amount of literature available on medicinal cannabis that the medical profession thought highly of cannabis and considered it a very safe and effective drug. As with any medication, it was prescribed for conditions that warranted its use. Until the late 1930s, many different conditions were treated with cannabis. Cannabis was commonly used as a calmative, as a hypnotic, as a sleep aid, to control muscular spasm, to control uterine contractions, to arrest uterine hemorrhage, use in labor, for neurologic pain, and many other disorders. It was 1937 when the federal government, under pressure, passed the Marijuana Tax Act. This act was meant to restrict the use of the plant. In the late 1950s, that law was ruled unconstitutional. At the same time, an act was developed to replace that law. Eventually, this law became the Controlled Substances Act of 1970. This law classified many different substances into several broad categories. Cannabis was placed in the most restrictive category, Schedule I. A Schedule I substance is considered by the governmental agencies as a substance with no legitimate medical use and a high potential for abuse. Despite the large and ever-growing body of evidence that cannabis and cannabis preparations have a legitimate medical use, the government continues to deny its use. In 1987, the U.S. courts told the Drug Enforcement Agency to hold hearings on the medical use of cannabis. After 2 years of hearings and evidence provided by both sides, the DEA law judge, Francis Young, gave his decision. Quote, "Based upon the foregoing facts and reasoning, the administrative law judge concludes that the provisions of the Act allow and require the transfer of marijuana from Schedule I to Schedule II. The evidence in this record clearly shows that marijuana has been accepted as being capable of relieving the distress of great numbers of very ill people. The judge recommends that the administrator transfer marijuana from Schedule 1 to Schedule 2. Signed, Francis L. Young, Administrative Law Judge, DEA. Today, we have added several new disorders to the list. These include glaucoma, AIDS, multiple sclerosis, and cancer. In recent months, the U.S. Health and Human Services, along with the Public Health Services, have tried to shut down the compassionate investigative new drug program in regards to marijuana. In the past year, we have been able to interview a number of patients who use marijuana either legally or illegally. At this point, I think it is important to hear what they have to say.
Hi, my name's George McMahon. In 1987, my doctors wouldn't release me from the hospital. I had to release myself. At the time, they wrote me a letter that said, "George, you're terminally ill." And I said, "Well, what does that mean? How many days do I have to live?" And they said, "We can't tell you. We don't think you'll make it home."